Roger Folsom. I see you, Mr. Folsom, as a participant.
Here.
Here. Russell Crutchfield. Nelva Lee.
Here.
Nelva Lee.
Here. Can you hear me?
Was that you, Miss Dr. Lee?
Yes, it was. I'm
Thank
here.
you. Cynthia Rucker.
Here.
Robert Coles. Shane Mobley.
Here.
David Cruz.
Here.
Anthony Williamson.
Here.
And I'll go back to Roger Folsom.
Here.
Thank you, Chairman. That concludes my roll call.
Thank you, Denisha, and we do have the required quorum today. I know Mr. Crutchfield and Dr. Coles are not able to join us today, but we appreciate very much the board members joining us and everyone else that's on the call. Thank you. We have a full agenda today, and we'll move right into that and welcome all of you here. We have for consideration and being asked to consider as a board for a vote, 4 items that will be in the final adoption phase and 4 items that will be initial adoption phase. And then also importantly, we'll have a presentation on the state health benefit plan for this coming year so that we can start our early enrollments. And we will be asked to consider that plan in rates and the structure of the plan. So that will be the task that we will have before us today as a board. I would like to start by referring to the minutes of previous board meetings of June 27 and of July 19. And in the absence of our secretary today, I would ask Roger Folsom if he's had a chance to review those minutes and would recommend approval.
Chairman Boyd, I've reviewed both sets of the minutes and therefore I'd make a motion for approval. All appears to be in order.
Are you there?
Mr. Chairman, can you hear me?
Yes, we can.
I have reviewed both sets of the minutes and all appears to be in order. I would make a motion for approval.
Motion is made for approval of the 2 minutes for the two meetings. Is there a second?
Second, Cynthia Rucker.
I'm sorry. Who made the second motion?
Cynthia Rucker, second.
Dr. Rucker has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, the minutes are approved, and thank you very much, Roger, for reviewing those and recommending approval. Next, we'll move to the committee report from the care management meeting that was held this morning. And we'll call on Anthony Williamson as the committee chair to make his report.
Thank you, Chairman Boyd. We had a good meeting this morning with good attendance and some interesting topics. We heard that the public health emergency from CMS has been extended to mid-October. And so the flexibilities that come with that are still in place. And the department is continuing to plan and work on its planning for the eventual unwind. Most of that consists of just updating numbers in terms of who qualifies for the various coverages. We also heard of some new coverage related to obstetrics and infant services. Specifically, donor breast milk is going to be covered in the inpatient setting Lactation consultants have been enrolled as a new provider type for home and community. And our postpartum coverage has been extended to 12 months from the prior 6 months in the waiver. Prior to the waiver, it was at 60 days. We had a fairly comprehensive presentation on dental services. This was in follow-up to an internal audit that looked at access to fee-for-service. Couple of quick highlights from that. Currently, there's 17,000 providers enrolled in Georgia in FFS and CMO plans. And the department is working on a number of strategies to continue to increase those providers. And we heard some details related to that, as well as looking at access for members in terms of how many providers may be in their county, how far they are. And it was determined that all members in the state do have access based on our definition related to distance. And that was essentially, the bulk of our meeting. At the end of the meeting, we did hear an update that value-based purchasing, which was something we had heard a presentation on in our May meeting, was not funded in the Appropriations Act recently, and so that will not be moving forward. And Mr. Chairman, that's the highlights of our meeting this morning, and I thank Lynette and the rest of the team for all of the work that they put into that.
Thank you, Anthony. Are there any questions or comments from the board? Hearing none, we will move on to the next item on the agenda, and that's Commissioner's report. Commissioner Doggle.
Good morning, Chairman. Thank you, and thank you to the members of the board for being with us today. A few updates for you this morning. First, we've got notice of a bunch of approvals from CMS recently on some of the pending items that we had submitted after your final adoption and approval over the past couple of months that we're very, very pleased about. First, and very significantly, the first of our directed payment programs, the Georgia Aid Program, was approved really almost at record pace by CMS on July 22nd. So we're extremely pleased about that, and thank you for your support of that program, and to all of our partners that helped put that together. We'll continue now at this point, continuing to plan to implement and operationalize that program as we continue to work with CMS on the other components of the directed payment programs, Georgia Strong, the hospital directed payment program, and our DISH reallocation methodology, which you'll hear about for final adoption again today. On July 29th, we received approval that our ICWP waiver was renewed, I believe for an additional 5 years. On August 2nd, our Appendix K for now and comp waiver rate increases was approved. And on August 3rd, our request to add a new provider type for lactation consultants was also approved. So again, want to extend our thanks to DBHDD, GHA, and our other partners for working on us to move all these initiatives forward. We're really, really pleased at the pace at which some of these have been approved by CMS. As you heard from the Care Management Committee, we do continue to plan for the eventual end of the public health emergency, or PHE, and the Medicaid eligibility redeterminations that will be required really immediately thereafter. Lynette and her team are working with our sister agency, the Department of Human Services, almost daily on those details, including a full communications plan and system programs and process changes to accommodate those mass renewals. I'll personally begin doing some outreach to our partners and constituencies in the next few weeks and months to ensure that they're informed about what our plan is and how this process will work, and to make sure that we're hearing and understanding their concerns and needs during this time of what will be a pretty significant effort on the part of the department and for all of our members. We're working very closely with the Georgia Building Authority to plan our eventual physical office location move sometime this winter. We will move from the 2 Peachtree building over into the Sloppy Floyd building, I think the East Tower. And so we have a large team of folks dedicated to working on that with the architects and other designers, everything from space layout and design to a new boardroom, to color choices and where AV and electrical outlets will be, while at the same time planning for what we do with all of our materials, files, fixtures that are currently in this building and how we get them from point A to point B and what we need to bring with this. So it's proving to be a pretty significant lift, but are very proud of our facilities team and other folks from the executive office that are working on that. So can't thank them enough. We're all very excited about this. So regardless of the work to get us there, we're very excited about where we'll actually end up being. We'll have a better space, better parking, better facilities for our staff, and we're just really excited about it. So we're excited and thankful to the legislature and others for supporting that initiative. One major personnel note and then some employee milestones. Richard Green, who has been our Medicaid appeals attorney, a senior attorney in the commissioner's office for a number of years and has a very significant state service history, has retired as of August 1st, and we wish him well and thank him for all of his years of service. Brian Anino will join our team on August 2nd. He's a current state employee and general counsel of another agency. He will join us as that replacement as my designee for those Medicaid final agency actions and appeals. I'm very thankful that he's agreed to come on board as well. And then, as I like to do, just highlight some employee milestones. Wanda Griswold, Thomas Tano, Jocelyn Miner are all celebrating 5 years of service with the agency in the state. Tommy Rowe, Shirley Kimball, Erica Smith are all celebrating 10 years. Tiffany McMore, Pamela Hunter are celebrating 15 years of service. Carol Franklin is celebrating 20 years, and Angelica Hester is celebrating her 25th year of state service and tenure with the department. So special thanks and kudos to our staff for being here and their dedicated service to us and to the state. We couldn't do it without them. Thank you. And that concludes my report, Mr. Chairman, but happy to answer questions.
Yes, thank you, Commissioner. Our questions or comments from the board for the commissioner, please? Hearing none, thank you for that report, and we will move into the agenda items that will require our consideration and vote. Brian Lipton, Senior Policy Advisor, will present the first of Medical Assistance Plans Amendment, and this will be for final adoption. Please proceed.
Thank you, Mr. Chair, and good morning to you and the board. I'm very excited to present this first item here today, which is actually the final component of DCH's new Medicaid Innovation Advancement Project, which will increase available Medicaid revenue dollars through CMS approval of a series of state-directed payment programs, state plan amendments, and departmental changes. As Commissioner Noggle noted, CMS has approved the Georgia Aid Program and is currently reviewing our other submissions. If all components are approved by CMS as submitted, Georgia and the department aim to eliminate 100% of uncompensated care at small rural hospitals, cut the overall level of uncompensated care in Georgia by approximately 50%, and reinvest $50 to $100 million in the healthcare workforce. I'll move right into our item, which is changes to disproportionate share hospital, also known as DSH, allocation methodology. So pending CMS approval, the department proposes to update the definition of rural hospital and revise the allocation methodology used to calculate hospital-specific DSH limits or DSH payments made on or after July 1st, 2022. A hospital will be considered a rural hospital if a hospital's county is not in a metropolitan statistical area as defined by the United States Office of Management and Budget, or as a county having a population of less than 50,000 according to the United States Census. Provided, however, that for counties and that which contain a military base or installation, the military personnel and their dependents living in such county shall be excluded from the total population of that county. The allocation methodology will be determined based on the level of directed payments to hospitals. If directed payments to hospitals exceed 10% of total payments to care management organizations, available DSH payments will be allocated such that eligible critical access hospitals, rural hospitals with less than 100 beds, and state-owned and operated acute care hospitals will receive up to 100% of uncompensated care provided to uninsured and Medicaid patients. There is no change to the existing methodology if directed payments to hospitals are less than or equal to 10% of total payments made to CMOs. There is no change to the amount of funds available for DSH payments under either methodology. This proposal only changes the distribution of those DSH funds. The amount of funds available for DSH payments will be determined based on the state's federal Medicaid DSH allotment and required state matching contribution. The state share of DSH payments for state government and non-state government hospitals will come from intergovernmental transfers made on behalf of the hospital. The dish allocation methodology will be evaluated annually, subject to the level of directed payments to hospitals. There were 2 opportunities for public comment, one held on June 29th, 2022, and the second held on July 6th, 2022. Written comments were due on or before July 27th. No oral comments were received. 1 written comment were received from the following: Carrie Summers, Chief Financial Officer and Executive Vice President, Georgia Hospital Association. The comment from Ms. Summers was in full support of the proposed state plan amendment. The comment noted that this proposal is just one component of a larger direct payment initiative, which will infuse a significant amount of new federal funding in Georgia's short-term acute care hospitals. These additional funds will help efforts to stabilize and promote the healthcare workforce, as well as cover a greater percentage of the hospital costs incurred to serve Medicaid and uninsured patients. The department thanks Ms. Summers for her comment and for her support. I'm happy to take any questions and respectfully ask for the board's favorable consideration of this item for final adoption.
Questions or comments from the board from Mr. Lipton, please? Hearing none, it has been requested that we consider for approval for final adoption. Is there a motion for approval?
Roger Folsom, motion for final adoption, Mr. Chairman.
And Mr. Folsom has made the motion for final adoption. Is there a second?
Second.
This is Shane, second.
David Cruz has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much. We'll move to our next item of the pertaining to Medicaid state plan amendment. And we will call on Kim Morris. And Kim, I believe you have 3 items to present to us. All 3 are for final adoption,
That's correct.
and you may proceed.
Good morning, Chairman Boyd, Commissioner, and other members of the board. Today, I'm presenting for final adoption pending Centers for Medicare and Medicaid Acceptance, a request to update the nursing home rates to the audited 2020 Medicaid cost report for all components of the rate file effective July 1, 2022. For state fiscal year 23, the cost to update to the audited cost report is an estimated decrease of 30 million, and for state fiscal year 24, an estimated decrease of 31 million. Update rate file using to audited cost reports for the following components: routine and special services, dietary, laundry and housekeeping, plant operations and maintenance, administrative and general, general liability, professional liability insurance, and property and related taxes and insurance. The annual update of audited cost reports is subject to approved budget appropriations. We will also be removing the whole harmless provision. An opportunity for public comments was held on July 6, 2022 at 11 a.m. via Zoom, and written comments were due on or before July 13, 2022. The department did not receive any oral comments, and 1 written comment from Donna Knackers, Vice President of Reimbursement, Georgia Healthcare Association. Ms. Knackers expressed support for the proposal to update the nursing home cost report to the audited 2020 Medicaid cost report and the amendment state plan, which requires that the rates be updated to the most current audited cost report in each subsequent year. The department thanked Ms. Knackers for her written comment and support. Ms. Knackers also requested that the department consider providing quarterly shadow rates, prospective rates using the 6/30/20 cost report to allow providers to adequately calculate and estimate the difference between interim rates and the final calculated rates. The department has determined that this would not be needed, as the department has historically been able to provide the providers their final rates prior to the effective date of the rate period. Ms. Knackers also asked the department to take into consideration allowing Georgia Healthcare Association to review verbiage from the state plan amendment prior to the department submitting the state plan amendment to the Department of to CMS for final approval. The department will take this into consideration and where applicable, work with our external stakeholders on this. At this time, I will pause to see if there are any comments, and if there are no comments, I will ask for the board for final adoption.
Any questions or comments from the board, please? We've been asked to consider for final adoption. Is there a motion to that effect?
I move for final adoption. Cynthia Rucker.
Dr. Rector has moved for final adoption. Is there a second?
Dr. Lee seconds.
There's a motion has been made and seconded. All in favor, say aye.
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 Aye. Opposed? Abstaining? Motion is approved. Thank you very much, and you may move to your next item.
Okay, the department is requesting final adoption from the DCH board to propose a rule change to amend rules and regulations for Medicaid assistance for Georgia, Comp Rules and Regulations Rule 111-3-34, ambulance provider fee. This change establishes a new ambulance provider fee program pursuant to the authority granted to the department in O.C.G.A. sections 31-8-179.2 and O.C.Ga section 31-11-31-2 as created by House Bill 271. Such payments will provide the necessary funding to obtain federal financial participation for private ambulance providers pending Centers for Medicare and Medicaid Services approval. Provider payments under this proposed rule shall only be used for the specific purpose of an ambulance provider fee. The provider fee amount should not exceed the amount necessary to obtain federal financial participation. A copy of the rule 111-3-14 is attached for your review. An opportunity for public comments was held on July 6, 2022 at 11 a.m. via Zoom, and written comments were due on or before July 13, 2022. There were no oral or written comments. At this time, I will pause for any questions and ask the board for final adoption.
Thank you. Are there any questions, comments from the board, please? We have been asked to consider for final adoption. Is there a motion to that effect?
I'm Shane, I motion.
Mr. Mobley has made the motion to approve. Is there a second?
Dr. Lee seconds.
I'm sorry, who was that, please?
Dr. Lee seconds.
Oh, Dr. Lee, thank you very much. And that has been made, motion has been made for approval and seconded. All in favor, say aye.
Aye. Aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Kim, you may move to your final item. Thank you.
Okay, today I'm presenting for final adoption, pending Medicare and Medicaid Services acceptance, a proposal to establish a new upper payment limit program for private 911 ground ambulance program for ambulance providers who provide 911 emergency transport services to Medicaid fee-for-service beneficiaries. Total cost for the program is $28 million, with state funding via a provider fee is $8.7 million. The private 911 ground ambulance UPL will be funded by mandatory ambulance provider fee assessed on private 911 ground ambulance providers. The ambulance provider fee will only be used for the specific purpose of a private 911 ground ambulance UPL. And the amount of the assessed fee should not exceed the amount necessary to obtain federal financial participation. Ambulance provider fee will be assessed on total 911 emergency transports for the following procedure codes: A0425, A0427, A0429, A0433, and A0434. The ambulance UPL will be paid annually to eligible private 911 ground ambulance providers. Attached in your documents is a list of the eligible 911 ground ambulance providers. An opportunity for public comments was held on July 7th, 2022 at 11 a.m. via Zoom, and written comments were due on or before July 14, 2022. There were no oral comments and several written comments. We received written comments from Conrad T. Kearns, Chief Executive Officer, Chatham Emergency Service, Secretary of Georgia Ambulance Providers Association, Board Member of the American Ambulance Association. Stephen Vincent, Vice President, Gold Cross EMS. Peter E. Kunos, Owner and Chief Executive Officer, President of Metro Ambulance Service, Chair of the Georgia Ambulance Providers Association. Terrence Raymota, Regional Director, American Medical Response. Joe Robinson, Vice President, Emergency Medical Services, Community Ambulance, at-large member, Georgia Ambulance Provider Association. John Halberton, Thrash Halberton Consulting. Reg P. James III, President of AmeriMed Ambulance. Amanda Jennings, Director of Marketing and Communication for Priority Ambulance. Robert Atkins, Southeast Regional President for Priority Ambulance LLC. Huey Atkins, Vice President of Operations, National EMS. Gary Coker, President and Founder, Center EMS. Susan Hightower, Administrator, AmbuCare. Steve Puckett, Founder, Puckett EMS. The following commenters express full support for the proposal to implement private 911 ground ambulance UPL program. The department thanks those commenters for their written comments. John Halberton and Reg James expressed concerns that the department limited the program to private 911 providers and wanted to know if the word ambulance got interposed with 911 during the process. DCH's response is the department made the decision to limit the program to private 911 ambulance providers to limit the number of providers who would be negatively impacted by the program. At this time, I will pause for any questions and ask the board for final adoption approval.
Questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Motion for approval, David Cruz.
David Cruz has made the motion for approval. Is there a second?
Shane Mobley, I second.
Shane Mobley has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, thank you very much, and thank you for providing us the written comments from the public input.
Thank you very much.
Thank you. That concludes our 4 items for final adoption consideration. The next 4 items will be for initial adoption prior to those, if approved, for initial, going out to public comment. So the next presentation will be Carisha Lang, Interim Executive Director of Office of Health Planning. Carisha, you may proceed.
Thank you, Chairman. Good morning, Chairman Boyd, Commissioner Noggle, members of the board. The Office of Health Planning presents rule changes today for initial adoption. The proposed rule changes reflect amendments to Rule 111-2-2-.071G1 and 2, review procedures for the Certificate of Need program. The proposed changes make updates to the criteria that must be met for a party to oppose an application for a certificate of need for a proposed project. Specifically, the proposed changes require either that in order to oppose an application for a certificate of need, an opposing party must offer substantially similar services as proposed in Georgia and within a 35-mile radius of the proposed project, or have a service area in Georgia that overlaps the applicant's proposed service area, or that an opposing party must have submitted a competing application in the same batching cycle and proposes to establish in Georgia the same type of facility proposed or offer in Georgia substantially similar services as proposed and have a service area located in Georgia that overlaps the applicant's proposed service area. Additional revisions are proposed to correct grammar, provide clarity, and modernize the rules. If the board agrees to initially adopt the proposed amendment, a public comment hearing will be held on September 7th, 2022 at 10 a.m. via Zoom. Parties interested in submitting written comments will be allowed to do so on or before September 9th, 2022 at 5 p.m. I'm happy to address any questions the board may have.
Questions, comments from the board, please? Hearing none, is there a motion for, as requested, for approval for initial adoption?
Roger Folsom, motion for approval, Mr. Chairman.
Yeah, Roger Folsom has made the motion for approval. Is there a second?
Dr. Lee seconds.
There is motion's been made for approval and seconded. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Thank you very much.
Thank you.
Next three items for consideration for initial adoption. The presentation will be made by Joe Hood, our Chief Operating Officer. Joe, you may proceed.
Good morning, Mr. Chairman, Commissioner, board members. The next three items that I'm presenting are all related to the passage of House Bill 481, and they differ only by facility type. Each of the effective rules, they have to be voted on independently, but they were made obsolete by the passage and effectiveness of House Bill 481. The first item for consideration is a request for initial adoption for a change in the healthcare facility regulation that are referenced in Georgia Rule and Regulation 290-5-32, Rules of the Department of Human Services, Chapter 290-5, Public Health. Specifically, the proposed rule change reflects an amendment to rules cited in Georgia Rules and Regulations 290-5-31, 01, 02, 04, and 05. By repealing said rules made obsolete by the passage of House Bill 481 during the 2019 legislative session. There will be an opportunity for public comment on September 7th, 2022 at 11:30 a.m. via Zoom. There will be no in-person attendance at the Department of Community Health. The Zoom link will be made available through the public posting upon adoption following the meeting. Written comments must be received before September 9th, 2022 at 5 p.m. If there are no questions, Mr. Chairman, I request the board's favorable adoption.
Questions or comments? Hearing none, is there a motion for approval for initial adoption?
Cynthia Rucker moves
Dr.
for
Rucker
adoption.
has made the motion for approval. Is there a second?
Second by David Cruz.
David Cruz has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Joe, you may proceed.
Thank you, Mr. Chairman. The next request is an initial request for adoption for a change in health care facility regulation 111-8-4, which references ambulatory surgical treatment centers. Specifically, the proposed rule reflects an amendment to a rule cited in Georgia Rules and Regulations 111-8-4.24 by deleting a reference to Chapter 290-5-32, Rules of the Department of Human Services, that is obsolete because of the passage of House Bill 481 during the 2019 legislative session. There will be an opportunity for public comment on September 6, 2022 at 2 p.m. via Zoom. There will be no in-person attendance at the Department of Community Health. The Zoom link will be made available through the public posting upon adoption following the meeting. Written comments must be received before September 9, 2022 at 5 p.m. If there are no questions, Mr. Chairman, I request the board's favorable consideration.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Roger
Dr.
Folsom, approval.
Roger Folsom has made the motion for approval initial adoption. Is there a second?
Dr. Lee seconds.
David Cruz.
David Cruz has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? It is approved. Joe, you may proceed to your next item.
Thank you, Mr. Chairman. The last one is an initial request for adoption for a change in healthcare facility regulation related to birthing centers. Specifically, the rule changes reflect an amendment to the rules cited in relation to birthing centers that are made obsolete by the adoption of House Bill 481 during the 2019 legislative session. There will be an opportunity for public comment on September 7th, 2022 at 11 a.m. via Zoom. There will be no in-person attendance at the Department of Community Health. The Zoom link will be made available through the public posting upon adoption following the meeting. Written comments must be received before September 9th, 2022 at 5 p.m. If there are no questions, Mr. Chairman, I request the board's favorable adoption.
Request has been made for initial approval, initial adoption. Is there a motion for that approval?
This is Dr. Lee. I make a motion to approve.
Yes, Dr. Lee has made the motion for approval. Is there a second?
Second, Williamson.
Motion has been made for approval and seconded. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Joe, thank you very much. And thank you for providing us the background material on this prior to the meeting, so we had an opportunity to review it. Thank you very much. With that, it concludes the items that we have been asked to consider today for final and initial adoption. And in the next two areas, we'll move to the state health benefit program, which is one of the main reasons for two meetings in August. One is the health benefit plan so that we can move forward with enrollments, et cetera. And later in the month, our other meeting will be related to budget. Kathy Craven will make the first presentation regarding the advisory council statement.
Okay, thank you, Mr. Chairman and members of the board. I'm here today to share with you a summary of the 2022 SHBP Advisory Council meeting, which was held yesterday. The SHBP Advisory Council was established in 2016 following the adoption of House Resolution 1382. The council is composed of both active and retired SHBP members from both the Teachers Retirement System and the State Employees Retirement System, and was created to allow members an opportunity to share member feedback with plan administrators. Executive Director Louis Amos shared a presentation with the council to review the 2023 SHBP plan recommendations that will be presented to the board today. He shared an overview of the current member makeup, as well as the recommended plan options for 2023. He also shared with the council some additional wellness programs that will be available to members in the new plan year. There were a few questions from council members, two related to plan rates, one related to employer-employee cost share, and the last related to performance rates of the third-party administrators for our Medicare Advantage plans. The department appreciates the opportunity to interact with council members and have a platform to receive feedback from a variety of SHBP members. If there are any questions, I'll be happy to answer them now at this time.
Any questions or comments from the board, please? Hearing none, thank you very much. We'll now hear the specifics of the plan presentation, and we will be asked to consider for a vote the design of the program and the rates. And Mr. Amos, the Executive Director of the State Health Benefit Plan, will make that presentation.
Good morning. Thank you, Chairman Boyd, Commissioner Noggle, and members of the board. There's a presentation that should be up. So as Chairman Boyd indicated, I'm Louis Amos, the Executive Director for the State Health Benefit Plan. Next slide. Obviously, the overview today, I'm going to discuss the goals for the plan for the benefit year plan 2023. We're going to discuss market trends, recommendations for the plan year 2023, discuss plan designs, plan options, wellness initiatives, behavioral health, member rates, and the open enrollment. Next slide. The goals for plan year 2023. In 2022, our primary goal was to explore opportunities for additional member benefits and focus on maintaining financial stability. For the plan year 2023, we're seeking to continue to focus on improving member health. We're going to focus on increasing disease management programs targeting diabetes and hypertension. We're going to increase the member involvement in the healthcare decision-making process and total wellness. And of course, we're going to continue to focus on maintaining financial stability for the plan. Next slide. When you look at the market, one of the things obviously we have to be concerned with is what are the impact and that's things that are impacting the market. One of the things obviously is inflation. We know that inflation is going to drive up healthcare wages in the healthcare sector, but because the contracts are done for primarily 2 and 3 years, the inflation trends are going to be a little bit slower, but we do anticipate a 1% inflation impact from 21 to 22, and then from 22 to 23, another 1%. Chronic conditions. We found that during the pandemic that members who had critical chronic conditions kind of delayed getting care. So once they start to re-enter into the system, we understand that we're going to see some increases. Spending around chronic conditions in terms of prevalence will continue to increase costs, both on medical and pharmacy costs moving forward. Behavioral health. We've seen a significant amount and throughout the industry, both public and private sector, that behavioral health has now become one of the increasing costs that affect our overall costs, and especially since the COVID pandemic. Telehealth, we are embracing telehealth. Obviously through the pandemic, the utilization increased, but we don't anticipate that telehealth is going to significantly increase the cost, but obviously it is something that the members is beneficial to the members. And then finally, specialty drugs. We know that specialty drugs is going to remain an overall primary driver for our pharmacy span. We are anticipating that the FDA will continue to improve significant numbers of expensive specialty medications, infusion drugs, injectors, and gene therapy. So those things, as we move forward, are going to probably have a bearing on our costs. Next slide. Our recommendations for the 2023 benefit plan design is for everything to remain same. Yes, sir.
Question, just back up a minute, just so I understand the definitions. What exactly are you talking about when you say behavioral health increases? What is that?
Well, that's for the mental health benefits, both mental health and drugs, alcohol. So those services, we've seen an increase in those services, and obviously we want to make sure that we provide those services to our members.
Okay. All right. So, all right, I understand. Yeah, go ahead.
Okay, thanks. So as we indicated, the plan design recommendation is for things to remain the same for the 23 plan year. The next slide. The medical vendors will remain the same. United Healthcare will offer an HMO, a high deductible health plan, a Medicare Advantage plan. Anthem Blue Cross Blue Shield will offer an HMO, HRA plan, and a Medicare Advantage plan. Kaiser will continue to be the regional HMO. The plan designs will remain the same. There'll be no changes to the co-pays, co-insurance, and deductibles. From benefit enhancement standpoint, we will continue with the weight loss medication and expansion of preventive screening and compliance initiatives. Next slide.
Now, these participation by people, I forget sometimes how big this plan really is.
Yes, sir.
I mean, totally in the state of Georgia, we have about how many participants in the plan?
So the total participants is about 670,000.
And when you break down those plans, what kind of percentage, how does it break down between the different providers?
So on,
percentage-wise?
yes, sir. So on the active side, Blue Cross Blue Shield obviously has the vast majority of the plans there, and the Blue Cross Blue Shield HMO. The second plan is going to be the Blue Cross Blue Shield Bronze Plan, Silver, and then the Gold. And then United Healthcare HMO has a small membership, about 20,000, and Kaiser has about 40,000 in that HMO. On the Medicare, on the retiree side, Medicare Advantage, the vast majority, I say over 97% of the participants are in United Healthcare. That's either going to be in the standard plan or the premium plan. So that's how the membership shakes out, sir.
I just wanted to refresh my memory as to what this all consists of.
Yes,
Thank
sir.
you.
All right. So on the pharmacy and wellness, CVS will continue to remain as the pharmacy benefit manager for the commercial non-Medicare Advantage plan members. That's for United Healthcare and for Anthem. No plan changes. Share Care will remain the wellness administrator for the commercial and non-Medicare Advantage plans. And their focus is going to be on member well-being and to continue to offer guided and wellness digital programs. We're going to continue. We're happy to say that we are now back out in terms of doing the on-site biometric screenings. So we're going to continue to expand those partnerships with the state school system and the state agencies for the on-site biometric screenings. And then Kaiser will continue to offer programs that will provide financial incentives for member participation. Next slide. Behavioral health. As we all know, behavioral health is a critical aspect of some of the things that we provide. In addition to the programs that are available through both United and Anthem, Share Care does provide a behavioral health program. It's called Guided Programs. These programs are offered at no additional cost to the member. It includes 4 evidence-based digital therapeutic programs to improve mental health and manage cravings. The first one is Unwinding. It deals with relaxation and meditation. Eat Right Now. It manages and controls food cravings. Unwinding Anxiety, managing stress and anxiety. And then Carving to Quit. It addresses tobacco, quitting tobacco and vaping. Kaiser will continue to provide behavioral health support in a holistic ecosystem. Kaiser offers a wide variety of digital, in-person, and telephonic self-help resources. Some of their programs include Calm, Finding Your Words, Managed Stress, and Mental Health First Aid. The recommendation from the State Health Benefit Plan is for our commercial and non-Medicare Advantage members' contributions for active members to remain flat for 2023. The Medicare Advantage premiums for retirees to remain the same for the Medicare standard options. So the lowest base price for the standard plan, MA standard plan option is $0, and that's for United Healthcare. The lowest price for the MA premium option is also with United Healthcare, which is $148 a month. Next slide. The following just kind of gives an overview of the Medicare Advantage standard and premium rates. As I indicated earlier, United Healthcare has a $0 premium for the standard. United Healthcare premium plan has $148 monthly premium. Anthem Medicare Advantage plan has a $146 premium monthly. And then the premium plan for Anthem has a $298.68 premium. Open enrollment, next slide. We're happy to announce for the first time since 2019 that we're going to actually go out and doing in-person meetings. The open enrollment period begins on October 17th through November 4th. There are 13 retiree meetings that will be held throughout the state. There are 20 benefit fairs that will be held throughout the state for both school system and state agencies. In addition to that, we'll be offering virtual meetings for those who may not feel comfortable in terms of attending in-person meetings, both virtual and WebEx and telephonic meetings. Commissioner Chairman Boyd, that concludes my presentation. Pause for any questions and ask the board's approval for these recommendations.
Questions, comments from the board, please? Hearing none, Louis, just for my information here, I think this is not the first year now that we have been able to present a program that does not include increased rates. How long have we been able to? We've been maybe a couple years at least. We've been able to hold that even with the medical inflation that we've seen or we hear about, et cetera, that we experience. So I think that's not too bad a job.
We appreciate it. So the last time the rates were increased in 2021, that was a 3 or 5% increase at that time, but currently the 2022 year, we remain flat, and then our recommendations to remain flat for the 23 year.
Okay. Very good. If there's no other questions, comments from the board, is there a motion for approval, please?
This is Shane Mobley. I'm motion.
Shane Mobley has made the motion for approval. Is there a second?
Cynthia Rucker.
Cynthia Rucker has, Dr. Rucker has made the seconding that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, and good luck. I'm sure glad to hear that you're going out and holding these meetings with the participants. That's good news, and hopefully that it will be positively received.
Thank you so much, sir.
Thank you. That concludes the items that we're asked for consideration today. I'd like to move on to the new business items on our agenda. And I would like to at this time address procedural issue that the commissioner and I have talked about, and that is a requirement of a review of our officer board positions, chairman, vice chairman, secretary. In preparation for that, I would like to appoint a nominating committee to consider that and ask that committee to meet and report back to us, hopefully in the September meeting, with a recommendation. And for that committee, I'd like to appoint David Cruz as the chairman of that committee, Anthony Williamson and Dr. Nelva Lee as the other two participants of that three-person committee. And if they will accept those assignments, and I believe that I visited with each of them and they've indicated that they would serve in that capacity for us. So we'll let them have their discussions, and we'll revisit that then with their recommendations in the September meeting would be the goal. Other item that I have in new business, I think this could help our committee members with their planning for meetings, since many of our board members have long term calendars that go out months and months. And the department issues for us a annual schedule of board meetings, so we know when those are going to take place, but we haven't always known very much in advance about committee meetings. And now that each of our committees both the audit committee and care management committees meet quarterly. It would be helpful, I think, with our board participants if we could publish, and Denisha has told me she will work with the committees to do that, exactly what months that it's anticipated for that schedule, so it will help our board members planning going forward. So I'd like to ask for that to be done, please. If there's any, is there any other items that we see should be brought before the board at this time? Hearing none, I thank all of you for your participation and remind you that we will have our next meeting on August 25. And a main topic of that meeting will be the budget presentation. So thank you all very much and have a good rest of the day. Thank you. Meeting is adjourned.